another avenue or another element of this is how front-loaded these designs are. They're very much focused on the first several $1,000s of expenditures, but we all know if they get a very expensive drug, if they get if they go into the hospital, that's all behind us, right? Very, very quickly. And so part of, I think, of where some of this is going is around value-based design. How do we get smarter in how we develop these things? Any thoughts on where you see that heading?
No, it's hard, and you talk about, especially, what I'll focus on is like, biologics for arthritis. Is the person has to pick up that cost the very first month in January, so they're paying the $2,000 or whatever it is in January rather than being able to spread it all out. I think there's some options that way too. But as we get into the value-based, it's still what is the cost? What's quality? Define quality. I think even in the medical profession, we have trouble defining quality. So what's the quality and whose value is it? Is it the employer's value? Is it the patient's value? Is it the medical carrier's value? That may be different.
Yep. Any thoughts on value-based design and where that's heading?
Well, I think from a practical standpoint relative to high deductible health plans, we used to say don't get sick in July because that was when the interns were newly starting. Now we say don't get sick in January because your employer may not have funded your HSA or HRA account. I think some employers have embraced the fact that they can front load the HSA or the HRA account, and in that way provide some level of protection for employees.
I also think it's really generational. We have an older population, but if I spend any time with people under 35 who are looking at a health care plan, I think they are perfectly comfortable with mobile applications and WebMD and self-diagnosis and telemedicine, and they're going to save their money. And so I also think that there are generational issues that at least we have to consider.
Yeah. And I think you talk about what are the opportunities of value-based care. I think there are certain procedures that lend themselves to that. So hip replacement, certain procedures that are out there. General care, it's harder to define that, but one specific event where the traditional recovery period is 6 weeks, then that's probably where it would come in best.
Yeah. And my sense is that there's certain care that we need to eliminate some of the barriers to, so that people get
Absolutely.
The advice that
Absolutely.
people need to get the care they need, right? Professional advice, yes. Right? And I think we need to start building in value-based discretion, almost reference-based pricing, if we can get to the point that we can have value-based contracting at the same time. Right. And that's a challenge. But I think the lesson I think we all take away from this is that healthcare is expensive. It's very expensive, and it's often way beyond the means of anybody. Mm-hmm. And so at the end of the day, we're going to have to protect the consumer at some level if they're going to actually have access to care. But that doesn't mean we can't get smarter in how we differentiate where that cost sharing applies, and that's kind of the goal of value-based.
And I would argue for a much broader definition of preventive.
Yep.
So the diabetic who goes regularly to a physician, that's preventive care. It is preventing exacerbation of a significant condition that can cause lots of other conditions. So I think if we could stop narrowly defining that once a year annual checkup and vaccines are preventive, but broaden it to treating chronic conditions that we don't want to be exacerbated.
And there's actually, even in the high deductible plan modality, there's actually policy activity looking at reinventing or redefining what an HSA compatible high deductible plan would be to allow more things to be paid before a deductible and whatnot, along those same lines.